was about 10 minutes after I treated her left knee, and her right hip feels much better. She's probably going to get a hip replacement in October or November. And, you know, the x-rays certainly indicate such, as does her orthopedic surgeon, you know. But tell us how you feel walking now after we treated the glide of your left knee.
Before, I came in here like limping, and I was like, the right sacrum felt like it was literally jammed, and I was almost tilting to the right whenever I would walk.
You were.
Yeah.
Yeah.
And it just felt like it was really stuck. And then it would go into my outer hip, the outer trochanter area in my hip. So after treating the knee, I was just walking and we were trying this cane, but then I realized I don't think I need this cane. And it felt like that whole gripping thing in my sacrum had actually released.
And you're now walking straight
And now I'm
without
walking
the
straight
lateral
without
deviation.
this kind of intense, like, you know, basically limping.
Yeah. I would not have predicted that.
Yeah, I don't.
And you were able to do stairs better?
Yeah.
Beautiful. Anything else?
Let me try the stairs again because there's another
Sure.
test I want to have.
You bet. Sounds good.
Because sometimes it would be like I literally would have to go like this up the stairs, like this.
Uh-huh.
But now
You're walking like a person.
I'm like a person, and I'm not feeling that grip in my hamstring.
Beautiful. Beautiful. Well, I'll take it.
I'll take
I won't promise the next hip person that I'll give them that, but I'll certainly look at their knees. Thank you so much.